Welcome to a new episode of Healthy Life. If you're an older man who masturbates, I need to ask you something. Have you ever wondered if this practice is truly healthy at your age? Or perhaps you've secretly worried that you might be causing yourself some kind of invisible harm. If these thoughts have crossed your mind, know that you are far from alone. This topic is surrounded by much confusion, outdated myths, and a distinct lack of clear, reliable information. It's one of the most common yet unspoken concerns among men in their mature years. And looking at the available data, it's easy to see why there's so much uncertainty. Studies show that while a majority of men over 60 continue to practice self-pleasure, many are doing so in the dark, unsure of the real effects on their hormones, prostate health, or even their performance with a partner. That's why today, we're going to have an honest, science-based conversation. I'm going to walk you through 10 surprising benefits of masturbation in maturity, and then crucially, we'll cover 10 potential risks you need to be aware of to ensure your practice is a healthy one. But before we dive into the details, if this is your first time watching, or if you're a loyal follower who hasn't subscribed yet, please consider hitting the subscribe button and turning on the notification bell. We're here to provide you with reliable and direct health information to help you live a better, healthier life. Your subscription is our biggest support to keep going. And now let's start with the good news first. The 10 benefits of masturbation after 50. Number 1 benefit: maintaining penile health. When an erection is achieved, blood flow increases into the spongy tissues of the penis, known as the corpora cavernosa. Think of it as a form of physical therapy for the male organ. This regular exercise helps maintain tissue elasticity, which is crucial for achieving and sustaining a firm erection as you age. When the frequency of erections decreases, whether due to the absence of a partner or a decline in libido, these tissues can lose their flexibility and become less responsive. Masturbation provides a way to maintain this vital blood flow, ensuring the tissues remain healthy and able to expand effectively when needed, reducing the risk of fibrosis and tissue hardening. Number 2, promoting prostate health. This is one of the most significant benefits supported by scientific research. Several large-scale studies, including a landmark one from Harvard University, have linked a higher frequency of ejaculation to a significantly lower risk of developing prostate cancer. The prevailing theory is that regular ejaculation helps to cleanse or flush out potentially harmful substances and old secretions from the prostate ducts. Imagine these ducts as small tubes that need periodic rinsing to prevent the buildup of deposits. This accumulation can lead to inflammation or cellular changes that might develop into cancer over time. Number 3, strengthening the pelvic floor. During orgasm, involuntary rhythmic contractions occur. These contractions engage and exercise key pelvic floor muscles, such as the pubococcygeus muscle. A strong pelvic floor is vital for many functions. It supports the bladder and intestines and plays a key role in erectile function by helping to trap blood in the penis, controlling ejaculation, and preventing urinary incontinence, a common issue for aging men. Orgasm can be considered a natural set of Kegel exercises that maintain the strength and tone of these essential muscles. Number 4, reducing the stress hormone cortisol. In our high-stress world, this is an invaluable built-in benefit. Research has shown that orgasm leads to a significant drop in cortisol levels. Cortisol, known as the stress hormone, when chronically elevated, can cause a range of health problems, including high blood pressure, weight gain, a weakened immune system, and anxiety. By naturally lowering cortisol levels, masturbation acts as an effective tool for stress management, contributing to cardiovascular health and mental well-being. Number 5, releasing a cocktail of feel-good neurochemicals. Orgasm floods the brain with a potent mix of chemicals that enhance feelings of satisfaction. The most notable of these is dopamine, the neurotransmitter associated with motivation, pleasure, and reward. Additionally, oxytocin, often called the love hormone or bonding hormone, is released, which promotes feelings of closeness and connection. This natural mood booster provides a sense of well-being, calm, and contentment, which is invaluable for mental health, especially in combating feelings of loneliness or depression that can arise with age. Number 6, aiding in the self-detection of physical issues. The practice of self-pleasure makes a man intimately familiar with his own anatomy. This regular self-examination is one of the most effective ways men discover early signs of conditions like testicular cancer, penile fibrosis, Peyronie's disease, or other abnormalities such as lumps, swelling, or skin changes that might otherwise go unnoticed. Knowing what is normal for you makes it much easier to spot any slight changes early, significantly increasing the chances of successful treatment. Number 7. Improving sleep quality after orgasm. The release of hormones like oxytocin and prolactin, combined with the reduction in cortisol, creates a powerful sedative effect. This hormonal cocktail helps the body relax deeply, making it easier to fall into a deep and restorative sleep, something that often becomes more challenging with age. For men who suffer from insomnia or difficulty sleeping, this can be a completely natural and effective way to get the rest they need without medication. Number 8. Enhancing overall pelvic blood circulation. Beyond just the penis, masturbation improves blood flow throughout the entire pelvic region. This is beneficial for the health of the bladder, prostate, and surrounding muscles. Good circulation ensures that oxygen and nutrients are delivered to all tissues and that waste products are removed efficiently. This can help prevent issues related to stagnation and poor circulation, which can contribute to a variety of urinary and reproductive problems in older men. Number 9. Serving as a training method for ejaculatory control. For men who struggle with premature ejaculation, masturbation provides a safe and private space to practice techniques like the stop-start method. This practice allows you to better understand your body's signals and recognize the point of no return. By practicing approaching orgasm and then pausing, you can build greater control, which can then be applied to sex with a partner, leading to a more satisfying sexual experience for both. Number 10. Keeping sexual desire and neural pathways active. The brain is the largest sex organ. By regularly engaging in sexual fantasy and physical stimulation, you are keeping the neural circuits associated with desire and arousal active. This helps maintain a healthy libido and sexual responsiveness, even if you don't have a regular partner. Like any other skill, if you don't use it, you lose it. Keeping these pathways active ensures that your sexuality remains a vital part of who you are as you age. The 10 potential risks of masturbation and how to avoid them. But to have a complete picture, we can't just focus on the positives. A healthy practice is a conscious practice. So let's now talk about 10 potential risks or negative effects you need to be aware of. Risk 1. Social isolation. This becomes a problem when self-pleasure stops being a part of a healthy sexual life and instead becomes a substitute for real human connection. If you find yourself preferring to stay home to masturbate rather than going out with friends or spending time with family, that could be a red flag. The solution here is awareness. Ensure this practice is complementing your life, not allowing you to withdraw from it. It should be an addition, not a substitute. Risk 2. Skin microlesions. This typically happens when masturbation is performed too aggressively or without adequate lubrication. These tiny tears in the skin, which may not be visible to the naked eye, can cause irritation, inflammation, and can even become a gateway for infection. The fix is simple. Always be gentle and use a quality water-based lubricant. Your body deserves care and respect. Risk 3. Desensitization. If you stimulate yourself in the exact same way, with the same pressure and rhythm every single time, your brain can become conditioned to only that specific type of touch. This can make it difficult to achieve arousal or orgasm with a partner, as their touch will be different. The key is variety. Change your technique, your rhythm, and your focus. Use your other hand or try different pressures and speeds. This keeps your nervous system responsive to a wide range of stimuli. Risk 4. Masking underlying causes of erectile dysfunction. If you can only achieve an erection during masturbation but not with a partner, it might be tempting to ignore the issue. However, this can mask serious underlying health problems like heart disease, diabetes, or hormonal imbalances. Often, erectile dysfunction with a partner is an early sign of a vascular problem. If you notice this pattern, it's essential to see a doctor for a thorough checkup to rule out any serious medical conditions. Risk 5. Nerve compression from poor posture. Many men masturbate while sitting in a hard chair or hunched over, which can compress the pudendal nerve in the pelvis. Over time, this repeated can lead to genital numbness or chronic pelvic pain. The ideal position is to practice in a relaxed and comfortable position, such as lying down with proper support, which removes pressure from this sensitive area. Risk 6. Becoming an unhealthy emotional escape mechanism. Using masturbation as your only tool to cope with stress, boredom, or frustration can create a behavioral dependency. It's crucial to have a diverse toolkit for managing your emotions, including exercise, meditation, talking with friends or family, and engaging in hobbies. When masturbation is a choice, not a necessity, it remains in its proper place as a healthy part of your life. Risk 7. Feelings of guilt and shame. Many men were raised with powerful cultural or religious taboos about self-pleasure. If these feelings persist and cause you distress, it can be incredibly beneficial to speak with a sex-positive therapist or counselor to help you reframe this natural practice in a healthier, more positive light. Releasing this burden can be extremely liberating. Risk 8. Pelvic congestion. While infrequent ejaculation is a risk factor for prostate issues, excessively frequent ejaculation, multiple times a day over a long period, can sometimes lead to a feeling of heaviness or aching in the testicles and pelvic area. This is thought to be caused by the congestion of blood vessels and tissues. The solution is moderation. Listen to your body's signals. If you feel pain or discomfort, give your body a rest. Risk 9. Potential impact on semen quality. This is only a concern if you and a partner are actively trying to conceive. While daily ejaculation does not harm your long-term fertility, it can temporarily reduce the sperm concentration in each ejaculate. For optimal quality, studies suggest an abstinence period of 2 to 5 days is best to ensure the highest sperm concentration. Risk 10. Disconnection from reality, often linked to pornography. If masturbation becomes heavily reliant on extreme or unrealistic pornography, it can skew your expectations and make it difficult to connect with a real-life partner. Reality may seem dull in comparison. The key is to balance any visual aids with your own imagination and memories of real, meaningful experiences. Visual material should enhance your imagination, not replace it. So as you can see, masturbation after 60 isn't simply good or bad. It is a tool. And like any tool, how you use it determines its effect. The secret ingredient is always consciousness. When practiced with awareness, respect for your body, and in moderation, it can be a powerful and marvelous ally for your health and vitality. I hope this conversation was helpful. I'd genuinely like to know what you think. What was the most surprising point for you today? Leave a comment below. Let's continue this important discussion together. If you found value in this video, please give it a like and subscribe for more straightforward, well-researched advice on mature health. Don't forget to hit that notification bell so you won't miss our next conversation. Stay healthy, and I'll see you in the next video.